Evan Haupt. I'm the CEO of Ammon Labs, and today's ToxTalk episode is about Xylazine, and I'm here with our laboratory manager, Paras Batra. He's going to explain what Xylazine is, what are some of the dangerous properties of Xylazine, and how it can be tested here at the laboratory. So without further ado, I'm going to let Paras kind of further explain what Xylazine is and what kind of trends you're seeing here at the lab.
So Xylazine, also known as tranq, is a common veterinary tranquilizer. In veterinary practices, it's commonly used for sedation, as an anesthesia adjunct, or as a tranquilizer. However, recently, drug dealers have been mixing it in with their fentanyl or other street drugs like cocaine.
Paras, why is Xylazine so dangerous, and why is it probably beneficial for a facility to add that to their test choice menu when they're ordering drug tests?
Xylazine is dangerous primarily because there is really no antidote available when there's an overdose due to xylazine. Secondly, if your street drugs are laced with it, you don't really know which drugs are and which drugs aren't. And lately, in our patient population, we've been seeing a 40% positivity rate for patients who were positive for fentanyl, showed up at least 40% for xylazine positive.
Wow, 40%?
Yeah. So it's best to test for it just because there's such a high positivity rate.
What do you think is leading to that trend? I mean, is anything specific that you're seeing in your conversations with facilities or directors?
Well, it's the drug itself, xylazine, because it's easily, cheaply available, and it's not a controlled substance in the U.S., so anybody can buy it and manipulate their other drugs with it.
Wow, that's hard to believe that's not a controlled substance.
No, not as of right now.
Not as of now. Yeah. What's the turnaround time for xylazine?
So in our lab, we turn around our urine toxicology results in 24 hours, and xylazine is also tested with our LCMS methodology and also turned around in 24 hours.
Okay. You mentioned that xylazine is oftentimes found within combination of fentanyl. Mm-hmm. Is it more or less dangerous in combination or with just fentanyl? How does that work?
Essentially increases the effects of fentanyl, prolongs the effects of fentanyl. Xylazine is a respiratory depressant along with fentanyl. Xylazine also causes gashes and wounds on wherever the person injects it, eventually causing infection and amputation in certain cases.
Wow. What are some of the street names for Xylazine?
Tranq, most commonly known as tranq.
Thanks for tuning in to today's ToxTalk episode. We'll see you next time.
See you next time.